All right. So again, thank you for joining us today for Devoted Health Plan's presentation, Best Practices for Using Your New Health Plan. We do a Learn Your Plan series for all of our different companies that have clients enrolled. I'm Lisa Wentz-Kennison, owner and CIC of MVIP Inc., Trozan Insurance. We've also added a few other agents on over the years. We've got Amy, Leslie, and Zeke, who are there for you if you need anything else. So let's go ahead and get started. We'll get through the first couple pages here. At the end, I will open up for questions on the chat. If you have any, we'll stop recording so that way those questions are not recorded. But for now, let's go ahead and plug on through this. So Devoted Health is new to Colorado still. This was their second annual enrollment period at the end of 2023. And their whole mission is to make your healthcare easier and more affordable and a whole lot more caring. What drew us to Devoted is the care factor. So this is one of the big stories. You can Google the Park Brothers. They've got some very entertaining videos for you out there and lots of information about their care guides, the whole reasoning behind the company. And from what we've heard, so many of our clients are saying they absolutely love the connection that they feel from their devoted health plans. So devoted solutions, they're putting the focus back on you, the person that owns the plan, and they want to serve people who are Medicare beneficiaries. That's you guys. They build relationships rather than roadblocks for you. And they really do truly believe in quality versus quantity. So just because you have a bunch of numbers, a bunch of options, doesn't mean that that's going to be quality care for you. Sometimes it's the partnerships that are with people who believe the same way that Devoted does. And they really try to make it simple. So many of our clients are saying, this is so much easier. I can text my claim form in. I don't have to print something and then upload it and do all these things. I can ask my care guide a question through text. And it makes it so much more simple if you have a one-stop shop for something like that. Lots of good benefits, lots of doctors and network, affordable care, and tons of extras. That is how you start with Devoted. And now we're going to talk a little bit about those details on your plans and get you started on the right foot so that you are off to the new year doing great. So new members, when you first sign up for your plan, you usually get a packet in the mail. And in that, you're going to have like a hard envelope that comes with a welcome. And it's going to have your ID card in there. Your ID card stands upright. It's different than most horizontal cards. Knowing about your plan gives you an overview of that whole plan so that you can look at it and see the basics of it. There usually is a magnet as well. The over-the-counter catalog is really beneficial. I don't think they put in a calendar this year, unfortunately. So that was something that a lot of our clients missed. They really liked that. What's important to know about your ID card, first of all, it doesn't look like an ID card at first. So here we go. That doesn't really look like your normal ID card. But on the front, it will give you your devoted number. That devoted number stays with you anytime you have a devoted health plan. No matter if you change plans, if you move to a different state and have a different devoted health plan, that number is going to stay with you. Your plan ID number, according to Medicare, is down here. Sometimes we'll ask you for some clarification. Can you read us the CMS number? Tell us what's on your ID card. Then when you flip it over, you're going to see some really good information. It shows your primary care provider on here. If for some reason that is incorrect, let us know. We can help you get it fixed, or you can let Devoted know. They can help you fix it as well. These numbers on the right side of the back of your card would be for your pharmacist. If they ask you for the pharmacy codes, the RX bin, PCN, and group numbers, this is what they need to process claims for you. Then your member services number, that's where you're going to get fully trained staff who can help you with your question. I always do say too that if you need help and you wanted to call us to see if we have the answer, you're welcome to do that. But your care guides are always there at Devoted as well. Then your dental benefit. So oftentimes our dentists are a little bit confused about how the dental works. So we are beginning to send out codes for our Devoted clients as well. And this is something that can be printed and taken to your dentist's office, or you can email it to your dentist's office as well. But it also tells them how to reach out and see what kind of benefits you have. Oftentimes you have benefits whether your dentist participates with Devoted or not. Then the pharmacist help desk and behavioral health services. How many times do you see a separate phone number right there for mental health counseling? That is amazing. I love that. That's such an important thing. All right, on our next page, then we're going to go over your care team. All members can contact the guide team. You can text with this simple 5-digit number. Whoopsie, didn't mean to turn the page there. The digital guides are real people. So they're there to answer your questions. You can say, hey, I had a claim that a doctor wouldn't submit. How do I do that? Or how do I get my wellness bucks? Or how do I earn this? How do I use my OTC benefits? All of these things will be included in some of the questions they can answer. Additionally, the care guides are there from 8 to 8, 7 days a week from April to September. And 8 to 8 I'm sorry, through March, 7 days a week. Then from April through September, you're going to have 8 to 8 Monday through Friday. Basically, the busy season runs from October through March for Medicare Advantage plans. Their customer service is all located in the United States. So that's one thing to know about this. You're not going to get somebody that is in another country. They're all within the United States. That doesn't mean they won't have an accent. Still, we have lots of people who have accents in our own country. So they're there to answer your calls, though. If you can't understand someone, ask for another care team member. Say, I'm sorry, nothing personal. I can't understand what you're saying. Can you transfer me back into the queue to get another person I might be able to understand? So devoted guides, that texting number is 86685. Again, you can text your questions to them. They'll identify you first, identify what plan you have, and then they'll be able to answer your questions. They really pride themselves in 30 seconds or less that you are in touch with a person. You can find a new primary care doctor. You can clear up billing issues. You can ask dental questions, all from the person that you reach on the phone. There should not be too much transferring around. Sometimes it has to happen, but most of the time that person that answers the phone can answer your question. HMO versus PPO. This is an important topic for us. HMO plans are out there. HMO technically stands for Health Maintenance Organization. So when you have an HMO, your primary care provider is your main doctor source. They guide your care and refer you to specialists. So that means that unless you've seen your primary care provider, you should not self-refer out to a specialist. You need a referral for seeing that specialist in most circumstances. It's always good to start with your PCP, even if you don't need a referral. You have access to in-network doctors and specialists. So that means if you choose to go to a doctor who's not in network, then you're choosing to pay for that out of your pocket. It's different with a PPO. So don't get panicky if you have a PPO and that was not your intent to have the HMO. HMO is different. When we have an HMO, we tend to have a little broader, um, or I shouldn't say broad, but richer benefits that come with the HMO. Because you have to visit your in-network doctors doesn't mean you have a lot less doctor choice, but your max out-of-pocket tends to be a little bit lower. You might have more dental benefits, more over-the-counter benefits, and things like that. The cost of your care simply is not covered if you choose to see an out-of-network doctor. Remember, emergencies are always exceptions. You get emergency care no matter what, whether they're in network or out of network. So then in contrast, a PPO stands for Preferred Provider Organization. You can see a specialist without a referral on there, although the specialist may require you to go to your primary care physician first. You can choose to see in-network or out-of-network doctors, but typically you do pay more if you see out-of-network doctors. That can be in a variety of different ways. Sometimes your copays are the same, but maybe your max out-of-pocket is a little bit higher if you go out of the network. All right, moving on to our next page, we will be discussing, hang on, there we go, the provider network. So Devoted really does partner with trusted doctors. They have an expectation of their doctors to fulfill some of the requirements that Devoted puts out there. So if a doctor is not willing to provide the care and the feedback that Devoted requires, then Devoted will not invite them to be part of the provider network. And so it's not just about getting every doctor in the network. They want to have quality again rather than quantity. If you don't have a primary care provider, or if you're wanting to switch primary care providers, it is important for you to search the Devoted website and look at their providers. And you can also talk to your care guide or text them if you're looking for a new provider in your area. Provider searches can be done from devoted.com. You can find more through your welcome kit. So there's a link in your welcome kit to that. Prior authorizations. This can be a confusing aspect for a lot of people. When do I need to have a prior authorization? So an instance of when you would need to have a prior authorization would be for durable medical equipment. What is durable medical equipment? That can be a CPAP, that can be a hospital bed, it can be a walker, a set of crutches, continuous glucose monitor. And when you need that prior authorization, who do you go to? You're going to start with your primary care physician, who may then refer you to a specialist, who may then order that durable medical equipment. Bariatric equipment, bone growth stimulators, neuromuscular stimulators, oxygen concentrators, specialty beds. Those are all different types of durable medical equipment and needs that would be considered under that prior authorization rule. You want to know what your coverage is before you write a check. If you purchase these items before getting that prior authorization, before having the doctor prescribe that based upon medical need, it likely will not be covered. So before you jump out and buy something, make sure you contact your physician for that prescription for the durable medical equipment. All right, you can submit reimbursement for some items. There are times when we need to get that item sooner than a prior authorization can come about, or that it's just delayed. You know, the doctor's out of town or something like that, and you really truly need it before that. Then you may need to have a reimbursement form. And at that time, they're really easy to do. You can, again, do that by text. If you need help, we can help you with those too. Extras. So a lot of people are like, yep, I've got my medical care covered. I know that's going to be there. I'm not too concerned about it. But what are all these extras that people talk about? The extras are really there to help you to be healthy and to stay healthy from head to toe. And taking advantage of them is really a large aspect of using your health plan. Most of our questions come from the over-the-counter benefit. How do I use it? What do I get to buy? And how does it work? So not all plans have $35 per quarter. Some have more than that. So be aware that this was for one particular plan. But this is a really good page that talks about it. What I like is that if we had CVS stores, not just a CVS pharmacy, but stores, you could go to the store and shop for it. But we really don't. The CVS stores inside Target do not participate with this program. So keep in mind that you're going to either be ordering online through CVS.com or by phone. The phone is a really nice way to do it. If you're needing a new copy of the OTC catalog, you can go online for a digital version or you can text OTC 2024 and they will send that to you. All right, so everyday items are included on here. Your toothpaste, I hope everybody's brushing their teeth every day. Hand sanitizer, Q-tips, vitamins, bandages. We've got all kinds of things, lotion, those things that you need to take good, healthy care of yourself. Just a quick note too, I will be sending this slideshow out to everyone. So you will have a copy of this, you'll be able to see that. And in that slideshow is a link to the actual OTC benefit catalog. All right. Next, silver sneakers. Silver sneakers gets you into unlimited access to thousands of gyms and fitness centers across the nation. So not just locally, but if you do visit somewhere else and you want to go to, keep up your daily habits, you want to go work out somewhere, you want to go walk around the track, you want to go for a swim, you can do that with your Silver Sneakers membership. So you have unlimited access. Plus, you've got live and on-demand classes as well. So those can happen over your computer. You don't have to be the person that goes to the gym. They cover everything from maintaining your balance and preventing falls to doing Zumba and Tai Chi. So there's a bazillion different options. They are excellent classes, and there's multiple levels within each class. If you don't have your Silver Sneakers ID number yet, you can call or you can text sneakers to the text number and you can get a Silver Sneakers ID. Also, sometimes at the local gyms, when you show up, if you don't have your Silver Sneakers number yet, they will help you get it. All right, Delta Dental. So everybody who's on this call today has either the core HMO or the choice PPO. Those plans have $3,000 of a dental allowance built in. So searching for providers is a great tool here. Devoted.com, search for providers. See if your dentist is in network. Even if they're not, you're still going to have some coverage. If you are out of network, it's not going to be as good a coverage. In other words, the money in your purse is not going to be able to go as far. So that $3,000, once it's paid out, means Delta Dental through Devoted is not going to pay out any more on your behalf for the rest of that calendar year. It will reset the following year with the allowance that's built in. So what kinds of things can be covered? You can get your oral exam, your routine cleanings, x-rays, and fluoride treatment for your plan for no cost, especially with an in-network dentist. Comprehensive care. This would include deep cleanings and fillings, dentures, crowns, bridges, root canals, extractions, oral surgery, and more things that we don't want to think about, right? But there's both preventive and comprehensive care on these policies. If you choose to go to an in-network dentist, then that dentist should be willing to accept what Devoted pays for that service. Once, however, you do hit that $3,000 mark, then the rest of your dental needs throughout that year, until we get to January 1st of the next year, will be exhausted and you will have to pay for the rest of those. Not too bad. Starting out with $3,000 in your pocket isn't bad at all. All right. Okay, True Hearing. I recommend this for everybody. So there's the number for True Hearing, 800-334-1807. You can also connect with your care guide by text or call them by phone. You will want to call and access True Hearing to get your hearing aid benefits. Yes, you can call the audiologist directly, but reimbursement, they really highly recommend calling True Hearing first to get an appointment with that local audiologist. That's what triggers the benefit to work for you. As you can see here, there are two different copays for those hearing aid options. And there are lots of different hearing aid options out there. So you're going to pay either $399 or $699 copay per ear or per hearing aid. The differences in hearing aids are immense. There's 48 different kinds of hearing aids out there. There is rechargeability on the hearing aids. If you don't need hearing aids, it's still an excellent idea to go in for your free hearing exam. I find it very, very important to get a baseline hearing exam. That can predict whether you may have some hearing loss that's sneaking up on you. It can really be a thing that people start falling when they start to lose their hearing. Falling is such an expensive thing to insurance companies that they're putting hearing aid coverage in for your benefits. Okay, vision. Vision is covered through iMed physicians. So again, talk to your care guide for locations. You can also go to devoted.com and search for vision providers. It's a really important benefit. You also want to get your eyes checked regardless if you wear glasses or not. But you do have a really nice $300 benefit on there for your glasses or contacts. All right, if you haven't yet, and of course you have to get your plan materials first, but if you haven't yet called and ordered a personal emergency response device, I highly recommend it. I don't want people to think about stigma here. I am going to say if you are ever alone by yourself, it makes sense to have one of these. Doesn't matter how active, how healthy you are, these devices are really important. There is no cost. There are no refill or referrals or authorizations required, and they are absolutely covered 100% by Devoted Health. When you're active on the plan, then you will call Life Station to get started. You can also call Devoted. If you are not looking at this presentation, you can't remember the name of the company, you don't know where the 800 number is, call Devoted and say, I want my personal emergency device. They have ones that look like jewelry, or they have ones that look like a fitness device. And some of them are GPS activated, so they do need to be charged, but they can also detect when you fall. So if you've ever seen anybody or talked to anybody that has fallen on the ice in a parking lot and been unable to get up, it's a really scary incident. And it is especially scary when it's dark out and you can't find anybody to help. So this can happen in your own home. This can happen in your own garage. And if you do have a fall like that, you'll understand why this is a really important device to have. Wellness bucks. So Devoted is giving you $300 a year. as a reimbursement. And it can be used to buy an Apple Watch, for instance. You can purchase specific classes if Silver Sneakers isn't doing it for you. You can purchase weights or exercise bands to keep you healthy, weight management programs, membership costs, and different things like that. Educational classes, programs, memory fitness. If you love the brain fitness games that you always have to pay for, that's a great thing. Also, though, mindfulness apps, Calm, Headspace, Balance. Then finally, another thing that you can use that $300 for is naturopathy or acupuncture visits. Those things that are typically not covered on health insurance. This gives you the opportunity, let's say a naturopath would charge $70 or $75 to see you. You can get several visits that way. So you pay for the items up front, and then you send a copy of your receipt with the reimbursement form. This can be done through texting, or you can call as well. And if you need more help beyond that, we can always help you too. Additional money. So when you get set up, you can qualify for a $50 reward. If you opt into the program for devoted dollars, and begin the checklist or by phone, so either one, online or by phone. If you do 4 of the activities, then you'll qualify for a $50 reward. These are activities that most people do every year, and they want to reward you for being healthy. They're encouraging you to be healthy. You can opt in as part of your Health Connections checklist, or you can call them and ask to opt you in to the Devoted Dollars program. Then when they send you your reward card, you're going to be able to use it for gas, for groceries, and that's really about it. But those are some of our big expenses. So we have another option that's out there, and 96% of everybody in Devoted qualifies for the chronic condition food card. Most of us don't think of ourselves as having some kind of chronic condition. But even if you take something like a thyroid medication, or you may be monitoring your blood pressure levels or blood glucose levels because you're on the fringe, those are considered chronic conditions, something that could cause an issue later on if it's left unchecked. Devoted is giving people $60 per month for healthy foods, or it can be used to pay utility bill, rent or gas, mortgage costs. It can pay your internet or cell phone. You want to spend the full amount, the full $60. You can buy food with it at the grocery store. And basically, what you'll want to do is to see if you qualify. Is there anything that you're currently dealing with that may qualify for this? Important thing, it's not charity, so to speak, but the minute that you qualify for it, you're able to use it to help keep you healthy. Why would they pay your utilities, like your gas bill or electric? Well, they want to make sure you're not getting too hot in the summer or too cold in the winter. Why would they give you healthy foods? Because healthy foods can be a little more costly than a bag of potato chips. So they're like, if we give you that little extra money for your healthy foods, maybe you will go that route. As far as cell phone and internet, they want to keep you connected to the outside world. Social is a really important aspect there. So you can visit healthybenefitsplus.com slash devoted health, or call to check to see if you can qualify for this. All right, next page. Other important coverages. So the durable medical equipment we did talk about a little bit already. There are some preferred brands out there. Ask your Devoted guide for assistance with that. Really, your doctor's going to be the one who's prescribing it and showing medical necessity for it. Then as far as different forms go, it's really easy to access it. You can either log into your Devoted, so mydevoted.com, or you can go to the plain devoted.com non-member facing, and you can find plan documents for all of your plans. You can get general reimbursement forms. You can do some advanced care planning, appointing a representative for your health needs, prescription drug forms, all really important aspects right there on the website without having to remember a login. I don't know about you, but I get a little tired of having to remember logins for everything. When you're looking for more, visit your member portal. So create a user ID and password, my.devoted.com, and get paid back for covered care. Sometimes the doctor's office will say, we haven't heard of this insurance, or we don't deal with anything besides XYZ company. You can still submit your claim to see if Devoted will reimburse you for it. You can get more plan documents and details. If you can't locate it, you can either print it yourself from the website or you can request a copy of it. Finding doctors, looking up medications. So formulary is a list of drugs that are covered on your particular plan. If your doctor is considering prescribing a medication, it's a really good idea to look it up to see first, is it covered? And then if it is covered, how is it covered? Coverage doesn't mean 100% of the cost. It means that you're probably going to have a cost share in there as well. If it requires prior authorization, your physician may need to tell the insurance company what it is that this medication is prescribed for. If you prefer paper copies of everything, that's okay. It's okay to still get things in the mail. So remember, texting them 86685 is the number to text. You can ask any questions. You can call Devoted, and if you're feeling sick, this is their kind of urgent care call number. So it's an 888 80 care 8. So that's it for today's presentation. Devoted's plan is super simple. Some of our other presentations take an entire hour to get through, but Devoted really tries to make it easy for you. That doesn't mean that it's going to be a natural thing right away when you get started with it, but once you start engaging with Devoted, you're going to see that they're really easygoing and easy to work with. We thank you so much for taking time today to really go through this, to understand something of what you have. And we're happy to partner with you with your questions on your health plans, regardless of what company that you have. So again, I'm Lisa. Thank you for attending. And our company absolutely adores working with all of our clients. Thanks so much, guys.